If CPAP and BiPAP keep confusing you, this video will finally make it simple. Both can help a patient who is struggling to breathe, but they do not work the same way. And in critical care, knowing the difference can change your patient's outcome. Let's start with CPAP. CPAP stands for continuous positive airway pressure. That means the machine delivers one constant pressure throughout the entire breathing cycle. The pressure stays the same when the patient breathes in and when they breathe out. Think of CPAP as holding the alveoli open so oxygen can move into the bloodstream more effectively. CPAP is used when the biggest problem is poor oxygenation. Common indications include pulmonary edema from heart failure, obstructive sleep apnea, mild hypoxemia, and atelectasis. One nursing pearl to remember is that CPAP works especially well for pulmonary edema because the positive pressure helps push fluid out of the alveoli and reduces the work of breathing. Now let's talk about BiPAP. BiPAP stands for bi-level positive airway pressure. Unlike CPAP, BiPAP delivers two different pressures: a higher pressure during inhalation called IPAP and a lower pressure during exhalation called EPAP. That extra inspiratory support makes it easier for the patient to take a breath. BiPAP is used when the patient needs help with both oxygenation and ventilation. Think COPD exacerbation, hypercapnia, respiratory acidosis, neuromuscular weakness, or a patient whose breathing muscles are becoming exhausted. The big difference is that BiPAP helps remove carbon dioxide. Here's the easiest way to remember it. CPAP helps oxygenation. BiPAP helps oxygenation and ventilation. Think of it like this: CPAP keeps the lungs open. BiPAP helps the patient breathe. As nurses, our job doesn't stop after putting the mask on. Continue assessing your patient. Monitor the respiratory rate. Watch the work of breathing. Monitor oxygen saturation. Trend the ABGs. Assess mental status. Check that the mask has a good seal. And always inspect the nose and face for pressure injuries. Here's the clinical pearl. The machine buys time, but the nurse recognizes deterioration. If your patient becomes more lethargic, their CO2 continues to rise, their work of breathing gets worse, or they become exhausted, non-invasive ventilation may be failing. That patient may need intubation. Also remember that CPAP and BiPAP should not be used in patients who cannot protect their airway, are actively vomiting, have severe facial trauma, or are hemodynamically unstable.